Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, existential threat. 21 states sue CMS over nursing home staffing mandate. The number of states challenging the federal nursing home staffing mandate has now grown to 21. These states argue that CMS overstepped its authority by implementing the federal minimum staffing mandate without congressional approval. The lawsuit claims the mandate poses an existential threat to the nursing home industry, as many facilities already face significant staffing shortages and could be forced to close. The plaintiffs argue CMS is relying on a vague statutory provision to justify the rule, which conflicts with existing congressional statutes. They claim the staffing mandate will create a ripple effect, leading to facility closures and reducing care options for LTC residents. The lawsuits come at a critical time as a recent Supreme Court ruling has made it easier to challenge the authority of federal agencies like CMS. Earlier this year, the court overturned the long-standing Chevron doctrine, which allowed government agencies to interpret federal statutes if deemed reasonable. With that decision, CMS's influence over regulations such as staffing levels can be more easily contested in court. The outcome of this legal battle could significantly impact the future of nursing home staffing requirements and the availability of LTC services across the country. Next, bill introduces new position to help LTC nurses amid staffing shortage. Pennsylvania is on the verge of becoming the 35th state to establish the CMA position in nursing homes, following the introduction of Bill 668. This move comes in response to ongoing staffing challenges, especially as the state continues to grapple with the effects of having the worst nursing shortage in the country just 3 years ago. The CMA position is expected to alleviate some of the burden on RNs and LPNs, who are currently the only nursing professionals allowed to administer medications to residents. Bill 668 provides a strategic solution to the state's long-term staffing struggles. Pennsylvania nursing homes need at least 1,000 more RNs and 700 more LPNs to meet federal and state staffing mandates. The CMA role will allow CNAs to advance their careers and help fill staffing gaps. Providers are expected to show strong interest in helping CNAs become CMAs, enabling RNs and LPNs to focus more on direct care and resident assessment. Additionally, the bill offers cost savings benefits by training CNAs to administer medications and take vital signs. Nursing homes could reduce reliance on costly agency nurses. CMA candidates will be required to complete 40 hours of educational and clinical training and must be recertified every 2 years. The new position is seen as a critical step in addressing Pennsylvania's nursing home staffing crisis while providing career growth opportunities. And up last, executive order on lowering prescription drug costs. President Biden highlighted the high cost of prescription drugs in the U.S., noting that Americans pay 2 to 3 times more for medications than people in other countries. Approximately 1 in 4 struggle to afford their prescriptions, with many resorting to skipping doses or cutting pills in half to manage costs. In response, Public Law 117-169, signed August 16, 2022, aims to significantly lower prescription drug costs and save millions of Americans hundreds or even thousands of dollars annually. The law, part of the Inflation Reduction Act, or IRA, introduces several key measures. It will phase in a cap of out-of-pocket costs for Medicare beneficiaries at pharmacies and establish a $35 monthly cap on insulin for those on Medicare drug plans or using traditional insulin pumps. Starting this January, Medicare beneficiaries with drug coverage will also pay $0 out of pocket for recommended vaccines. Additionally, pharmaceutical companies that raise prices on drugs used by Medicare recipients faster than the rate of inflation will be required to pay rebates to Medicare. For the first time, the Secretary of Health and Human Services will have the authority to negotiate prices for certain high-cost drugs for Medicare beneficiaries, providing significant savings. The Innovation Center plays a key role in lowering healthcare costs by testing new payment and delivery models promoting access to affordable meds. These efforts include exploring models reducing cost sharing for commonly used drugs and value-based care. The comprehensive approach aims to ensure Americans have better access to affordable prescription and improve healthcare outcomes. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your quality improvement needs, call the Q.